A sweeping new genetic study could reshape how mental illness is diagnosed and treated, potentially affecting millions of people worldwide. Researchers say that many psychiatric conditions, which were long considered separate illnesses, may actually share the same biological roots. This raises questions about whether patients need different diagnoses and medications to treat them. The study, published in the journal Nature, analyzed psychiatric and genetic records from more than 1 million people who were diagnosed with mental illnesses. It compared the records with those of 5 million people without a diagnosis. The researchers found that a number of psychiatric disorders share common genetic drivers, suggesting they may be more biologically related than previously believed. Traditionally, psychiatry has focused on behavior. It looked at what patients say, how they act, and what symptoms they show. But this new research suggests that adding biology into the equation could lead to more precise and effective care. The scientists examined 14 psychiatric disorders, including depression, anxiety, schizophrenia, bipolar disorder, and ADHD. They found these conditions cluster into just 5 broad genetic categories. This includes substance use disorders, internalizing conditions like depression, anxiety, and PTSD, neurodevelopmental disorders such as autism and ADHD, compulsive disorders like OCD and anorexia, and a 5th group that includes bipolar disorder and schizophrenia. In fact, bipolar disorder and schizophrenia were found to share about 70% of the same genetic influences. Researchers say the findings could reduce the burden on patients who often carry multiple diagnoses and take multiple medications for conditions that may share the same biological cause. The researchers added that almost half of the people on Earth will experience a psychiatric disorder in their lifetime, and more than half will be diagnosed with at least one additional disorder. The team identified 238 genetic variants linked across the disorders, including a hotspot on chromosome 11, home to genes tied to mental illness, cancer, as well as blood disorders. One of those genes, DRD2, is already the primary target of many antipsychotic medications and plays a major role in dopamine signaling. Experts caution that the findings will not change clinical practice overnight, but others see it as a turning point.